Circling back to our top story on nurses, with Singapore offering its nurses up to 100,000 Singapore dollars spread out over 20 years to retain and attract talent. For more discussion on this issue, we speak now with Associate Professor Trevor Yu. Now, he's from the Division of Leadership Management and Organization at Nanyang Business School, NTU. Professor Yu, substantial payouts being, offered to nurses in the hope that they will join this profession and stay in this profession. Do you think this would be, over the years, an effective strategy?
Yes, good evening to you. I think these are substantive payouts indeed. I think that it's a good, significant first step towards attraction and retention, especially for attraction because of the overall quantum. It does stand out as a huge investment and thus a powerful signal that Singapore and the healthcare sector is investing heavily in this specific group of professionals. With respect to retention, however, I think that things are more complicated. Definitely, nurses will definitely think twice about how much they are leaving on the table if they choose to leave the profession. But there are also other factors that are important challenges when it comes to retention to do with the overall work environment and also their career and personal aspirations.
Professor Yu, a substantial payout as you describe it, but there is competition for nurses globally. They can move quite easily from one sector to another, depending on the country, of course. But these monetary incentives, how far do they actually put Singapore in a good position, would you say, to actually, sort of draw nursing talent from around the world?
I think that locally, this will be an attractive incentive to entice people who are considering nursing as a career, especially at the stage where they are choosing between courses and education opportunities. Our ITEs, our polys, our university, I think they will help to entice people to more applicants into these type of courses. Foreigners will also be attracted to apply their trade here in Singapore. Again, the more interesting question is to do with retention, and that goes beyond just the financial-based incentives, because it's also the nature of the work and the environment, the health system, the specific employer organization, also the immediate peer and supervisory relationships that will play a huge factor to help embed these professionals into the system and to convince them to stay on longer.
Professor, you've in part answered this question. I just want to bring together your various points. So attracting is one thing, and that's usually for people starting off. And then there's retaining. So it's older workers. And you've mentioned this in the context of a good work environment, good relations with both your peers and your supervisors. And also, when you think as you get older, is this all I'm ever going to be career-wise? That's a question we all ask ourselves. Something I didn't ask when I was young, but as I get older, I will ask. For the nursing profession, what specifically can, say, a facility, a hospital do to ensure that it meets at least some of these requirements?
Yeah, it's the entire employment package, as you are alluding to, right? Think about it in terms of both the financial rewards as well as the relational rewards that serve to provide a sustainable and productive employment relationship. So in terms of benefits, I would ask if there are enough provisions to help support these professionals in coping with the stressful nature of their job. We find in our research that supportive relationships at work, particularly among peers and their supervisors, can go a long way to help in the emotional and physical coping with the stressful nature of their work. And I also read in the Straits Times report that if we are finding that nurses do tend to leave the profession for personal and family reasons, then we should be asking whether the current benefits offerings are enough to help them cope with these responsibilities or to pursue their own personal aspirations. Perhaps longer-term offerings like sabbaticals or job-sharing arrangements should be pursued harder or pushed harder within the sector. What we are finding in our interactions with the sector is also that even though flexible work arrangements may be available, that there tends to be a hesitancy to utilize them. So this suggests that the supervisors and top management within the sector do have a stronger role to play in helping to encourage and to facilitate the taking up of these arrangements, because it is in the interest of long-term retention for their sector.
A wider look at what nurses may need to support them may well be necessary as well. Professor Yu, thank you very much for that. Associate Professor Trevor Yu there from NTU's Nanyang Business School.